agency. I think number 8. The only thing that we'll have to do.
Educator with the Southern Nevada. Great. Good morning. I'm Debbie Nabler. Honored to be here. Thank you. I'm a co-founder of Moms Against Drugs and Drug Epidemic Awareness Walk Across America, representing all the grieving families.
Hello, I'm Christine Payson. I'm the Drug Intelligence Officer with Nevada IDA.
Thanks so much. I just want to be certain that y'all can hear well enough on the phone and on the screen. Can you hear okay, everybody?
Yes.
We can hear you fine right now, yes.
Very good. Okay, just want to be certain. Yes, ma'am.
I'm Dr. Leslie Dixon. I'm a psychiatrist. I work with Center for Behavioral Health, taking care of folks with medication-assisted treatment, and I'm also a psychiatric association.
Very good. Now we have people elsewhere in the room. Why don't we introduce them?
I think we'll have time for public comment. Should we move to Carson?
Yeah, I didn't know if they were. Okay. All right, let's go to Carson. Go ahead, Carson. Introduce yourselves, please.
Good morning, Shayla Holmes, Director of Human Services and Public Guardian for Lyon County.
And good morning, Eric Schoen, Executive Director with Community Chest, serving Story, Mineral, and Lyon counties.
Good morning, Steve Shell, Vice President of Behavioral Health at Renown Health in Northern Nevada.
Good morning, everyone. Lisa Lee, Program Specialist with Washoe County Human Services Agency, and also a person in long-term recovery. Everything goes well, I'll have 20 years in February.
Wow, that's great. All right. Anyone else in Carson? Okay. Anyone else on the phone, please? Go ahead and introduce yourself. Okay.
Good morning.
Oh, very good. Go ahead, sir.
I'm a person in long-term recovery. I'm also the founder and CEO of a nonprofit in Las Vegas called The House, and definitely interested in seeing what I can add to this group.
I'm not sure they caught your name, though.
Oh, I'm sorry. My name is Jeff Iverson.
Good to hear your voice, Jeff. Anyone else on the phone? Okay.
I think we can.
All right, very good. Are you
Ms. Cheatham?
Ms. Cheatham? Hello.
Hi.
All right, introduce yourself, please.
Sure. Hi, I'm Chelsea Cheatham. I'm here from Track the Exchange.
Thanks so much. Okay, thanks so much, everybody. Again, welcome. We will move on to the next agenda item number 5, which is a history and overview of the legislation, including our role and our mission.
We're going to push that back.
We're going to push it.
The Assemblywoman Tolles. We'll try to come in later to do that.
Oh, okay, very good. So we will take the agenda item out of order and move on to the next agenda item number 6.
Number 4. Number 4.
What did I just do? I'll skip 4.
Number 4.
I don't know why I skipped 4. All right, very well. Number 4, election of committee chair and committee vice chair. And I think we're going to have someone to run this initial election for us, ma'am. Come on.
Yes, sir. Is there a motion to elect a chair?
Assemblywoman Tolles would like to make a motion to elect Attorney General Ford as chair of the working group.
Is there a second?
I'd like to second that.
All right, all those in favor say aye.
Aye.
All opposed say nay. The motion passes unanimously. Mr. Chair, I'll turn the meeting over to you.
Well, very well. Thank you so much. I'm honored to be the chair of this august group. Y'all like my word? August? Yeah, august group. Thank you so much for the nomination. Again, looking forward to working with everyone here on the committee. We will now open up the nominations for vice chair of this august committee. Do we have any nominations for vice chair? Yes, Dr. Woodard.
Stephanie Woodard, for the record, I would like to nominate Assemblywoman Tolles for vice chair of the working group.
Okay. Is there a second for the nomination for Assemblywoman Tolles for vice chair?
This is Jeff Iverson.
A second.
Danny Tillman, for the record, I'll second.
I'll say your name again. Danny Tillman has seconded the motion for Jill Tolles to be the vice chair. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye. Any opposed? Any abstention? Motion carries. Very well. We have a chair and a vice chair of the committee. Thanks so much. Okay, and we were going to skip agenda item number 5 and move on to agenda item number 6, which is a discussion. I'm not certain that Christie, CJ, are you on the line? Okay.
Yes, I am, sir. I'm right here.
Oh, okay. I'm sorry.
With Mark Kruger.
I can't see anybody down up in Carson, so I don't know what's going on. Okay, well, hi, CJ. The agenda item is for you to discuss the opioid litigation settlement, and I will turn the mic to you, ma'am.
Thank you. I'd like to also introduce, we have Mark Kruger, who is our consumer counsel for the Bureau of Consumer Protection in the Attorney General's office. I cannot see Mark on my. On the video. Oh, there he goes. So good morning. And what we want to do is spend a little bit of time talking about the opioid litigation itself. We're not going into too deep of a dive, but we want to give all of you an overview of really what is the genesis for this meeting here today. In working with AG Ford and those of us and his staff worked with Assemblywoman Tolles and Dr. Woodard and Tina Dortch, Dr. Dortch, and a few other people, really getting stakeholder involvement in what are we going to do with the opioid litigation funding, if we should get it, when we should get it. And so one of the things that the people really wanted to make sure was done was that if we did, and we already have received some monies, but if as monies come in from these lawsuits, we want to make sure it is spent to the best that we can to overcome these substance use issues for Nevada. Now, the SURG committee is wonderful because it's broader than just opioids. And Jill Tolles, Assemblywoman Tolles, and Dr. Woodard will go over the legislation itself and talk more in depth about what SURG is. But what we're going to talk about now is the opioid litigation, and ultimately SURG will be making some recommendations to other committees and to HHS on how Nevada can best conquer substance use in throughout communities in our state. So first I want to say that if some of the documents Mark and I are going to reference are located, next slide, please. Thank you, are located on the AG's website. And so there's the link there to the website, and on that page, you will find the declarations of findings, contingency fee contract, the second amended complaint, and the One Nevada agreement on allocation of opioid resources. Next slide, please. The declaration of finding is a process that we had to go through in order to even, in order to really start tackling this problem on the level that we're trying to tackle it. So what happens is that the governor on January 24th, 2019, declared that the opioid epidemic in Nevada required assistance of outside counsel for litigation. And I'll explain a little bit more as to why that's needed. And it's a very large complaint. We're suing over 60 people, and it's very complex and requires really all hands on deck. And so the governor declared that we needed help in doing that. So part of that is once we went, the Bureau of Consumer Protection, along with myself less so, but we walled AG Ford off from the process. But the Bureau of Consumer Protection put out, according to the state processes, a bid, and we had a number of law firms from across the country and the state bid on the contract, and that was awarded on May 2nd, 2019. So the process took a little bit of time, and I will note that the committee so that selection committee for the law firm bid was diverse and also contained members from people from across the state who reviewed, interviewed, and scored the different law firms. The other thing that's on the website is the second amended complaint. And the reason why it's second amended is we've added defendants. So as we continue to, the discovery process continues. Discovery process is that, in a short form, is that process whereby we collect information on the problem. We collect information from the defendants get information from us, we collect information from stakeholders across the state. And so as we continue through the discovery process, we had to add a few people. So we have the second complaints up there, and you can see a list of all the people and entities that Nevada is suing. And then I'm going to turn it over for a description to Mr. Kruger, who will discuss what the One Nevada agreement is. And he will not give himself accolades, but I will give him accolades, and I'm sure AG Ford will. He worked tirelessly to reach out to leaders in local communities, including rural communities and frontier communities throughout the state, to make sure that we could get as many participants as possible. And I think he got somebody from every county, but I will turn it over to you, Mark.
Thanks, CJ. And actually, we have a slide on it that goes into a little bit more detail, as well as the second amendment complaint. If you want to do the second amendment complaint, or I can do this one as well, either way.
You go ahead.
Okay. As CJ was saying, on the second amended complaint, we have 61 defendants. Most of them are corporations. There are some individuals, in particular, some of the doctors that we've heard about throughout time in Nevada that have run pill mills and things like that involving opioids. But unfortunately, some of these corporate defendants have already taken advantage of filing bankruptcy. And one of those was Purdue Pharma. And we're going through the bankruptcy process with them to see what we can recover out of bankruptcy. There's something to note about this second amended complaint and this whole entire litigation. It's a very comprehensive, complex litigation. We have multiple causes of action. So why I bring that up is it's important to note that you're going to hear things about what's going on in other states and in other counties throughout the nation. And it's important to not get caught up in what's happening in other cases, but to keep involved in only what's happening in ours. And right now, we're still on track. We have a very unique case because we have probably one of the only cases in the entire nation that include defendants that were manufacturers, distributors, and pharmacies involved in this opioid epidemic. Currently in the discovery phase, as CJ said, and I think what's important about that is the amount of documents that our state has turned over is just mind-blowing and very impressive. And I have to give Department of Health and Human Services accolades because they stood up and got this stuff together, the vast majority of it, but not just them, DPS, other agencies throughout the state came together as a solid team and produced what would amount to 15 million pages of documents. It's just over 3 terabytes worth of data. So we're in the process of taking depositions, and we have a firm trial date of April 17th, 2023, which seems like a far way away, but it's actually, in terms of litigation, it's right around the corner. So we're moving forward. You'll go to the next slide, please. We can get into the One Nevada agreement that, and thank you, CJ, but it was a team effort on all our parts, and including yourself. And the One Nevada agreement is important because what it does is it allowed the state to figure out upfront how we were going to be able to fairly and equitably allocate any recoveries from any one of our respective litigations. And even though the state's out front of these other counties, in that our trial date is before anyone else's, and we're doing the bulk of the work, it was important that, and I think important for this committee as well as every other committee, but it's important to note that this is a statewide epidemic, and we need to approach and address it in a concerted effort, both from the state perspective and counties. So what we did in this is we got all of the counties in the entire state, all 17 counties, agreed to enter into this agreement to allocate. And that's important because opioids doesn't care. It's like fire. It just crosses county lines. So we wanted to make sure every county was accounted for, even if they didn't have litigation. And then we also wanted to kind of pull into this envelope all of the cities that were litigating, so that we now have a document that we can use to help negotiate settlements and to fairly and equitably allocate money amongst ourselves. All of the money that the state receives under this allocation agreement follows Nevada law and goes into the Fund for Resilient Nevada. That's important because that is the driving dollar place for your recommendations to the Department of Health and Human Services regarding the state plan and the needs assessment that needs to be done for how to best address the opioids epidemic, recognizing that in different parts of the state, there's going to be a need for different ways to address the problem. And that's it for me.
And just along those lines is, and it's kind of implied, but just to say it, when this litigation being as complex as it is, and as Mark just mentioned, and you guys, I know I'm talking to people who, you guys have boots on the ground, you've lived experiences, you know the impact of not only opioid on the opioid epidemic, but on substance abuse epidemic in general. And so the different defendants, as Mark said, played a different role. They each did various different things, and we won't receive one lump sum money for every defendant. Like Mark's already said, some defendants have declared bankruptcy. So the process of recovering and the timing of recovering damages for the harm that they've created, recovering from those damages, is going to be different than a defendant that says, okay, we want to settle, like McKinsey recently settled with us. And so there may be even some defendants that wish to go to trial. So we may have at some point a trial with at least some defendants. So the monies that will come in as a result of this lawsuit, they will come in staggered. There may also be judgments that courts may rule where it says that monies will come in over a series of years. So it's not like we're going to expect to get one pot of money and that's it. It will come over depending upon how the lawsuits are with each of those defendants. And so with that being said, that the account that Mark referenced is also available. It can take grants. It could also take, for example, if the AG's office prosecutes, let's say, a doctor who was prescribing opioids or anything else, but, and we get a conviction, we could potentially ask for restitution to the state. And if we were to ask for restitution to the state, it could go into that account. So that account is able to take in a variety of other funding. Anything I missed from that, Mark, Mr. Kruger?
No, that was very comprehensive.
And that's all I had for today. So thank you for allowing us to be here and to present this information to you.
Thanks so much, CJ, and thanks so much, Mark. We appreciate the presentation on this. This is a discussion item. Are there any questions or comments on this particular agenda item? Questions for our presenters? Anyone on the phone up in Carson?
Good morning. Lisa Lee for the record. Thank you for the presentation. I did want to just everyone on this body to do a little bit of light reading. One is the book, and this is all pertinent to this particular working group, but one book is Dope Sick by Beth Macy. It's also available on a 8-episode miniseries on Hulu. it really unravels kind of all of the various factors that affected the marketing of OxyContin and the early efforts to kind of challenge Purdue Pharma. The other book is Unsettled by Ryan Hampton. I highly recommend this book as well. The fabulous Ryan Hampton, who lives in Las Vegas, Nevada, has written a really compelling account of kind of the proceedings of the bankruptcy. And anyway, urge everybody on this council to read. Thank you.
Thanks, Lisa. We have a comment here. Yes, ma'am.
Yeah, hi, Jessica Johnson for the record. I was noticing the trial date, that's April of 2023, and just will that impact any of the decision-making of this body? Do we have to wait until the trial date in order to allocate, or are we able to move forward in the interim? I don't know how that plays out. So that's sort of my question.
Yeah, so this committee has several tasks, one of which is to make suggestions to HHS, I guess it is, on how to spend the money. But that's not all that we talk about here. And that's all. We actually have a report that's going to be due on January 31st.
That's my other question.
Yeah, and so, but yes, relative to spending the money or making suggestions on how to spend the money, we will be constrained by when we get settlements in. The trial date's not till till 2023, but just as we settled with a potential defendant earlier this year, there may be other opportunities for settlement with other defendants coming up, and as those monies come in, suggestions from this committee will be more than appropriate. Okay. CJ, were you going to say something on that?
I was just going to say, and Dr. Woodard will talk a little bit more about this in her presentation, but there's a lot of work to be done with getting the state plan together. And so I don't want to give away her presentation, but there's a lot of work to be done. So I echo what AG Ford just said.
All right, thank you. Any other comments, questions, concerns on this agenda item before we move on? Okay, hearing nothing further, we will move on to agenda item number 7, which is an overview of the open meeting law and its requirements. Rosalie Bordelove, are you on the screen or on the phone? Oh, I see you, Rosalie. Hi there. Go ahead.
Good morning, everyone. I'm Rosalie Bordelove with the Attorney General's office. I'm your board counsel, so members, to the extent that you have legal questions, I'm always available to you to answer those questions. And I'm going to give a very brief high-level overview of Nevada's open meeting law with a focus on its requirements as they relate to members of public bodies. Just so to the extent that there's members here who haven't been sat on other public bodies in the past, this will give you a little bit of information about those requirements. And let's go to the next. So Nevada's open meeting law is in NRS chapter 241, and it applies to meetings of public bodies in Nevada. This includes subcommittees created by public bodies, even if the subcommittee only has the power to make recommendations. So if you at some point break out into subcommittees, keep that in mind. There are some exceptions to this general mandate, but the Nevada Supreme Court has stated that the spirit and policy behind the open meeting law favors open meetings, and any exceptions thereto should be strictly construed. Next slide, please. So not every gathering of a public body is a meeting under the law. In order for a gathering to be a meeting, there must be a quorum of members together with deliberation or action. So a quorum means a simple majority of the public body or other proportion established by law. AB 374 does mention a quorum, but it also defines it as a majority of members. So that's when you hit that quorum standard. Deliberation means collectively to examine and weigh or reflect upon the reasons for or against an action. An action means a majority vote. So either one of those together with a quorum present is what makes a meeting. And you want to avoid having those types of discussions with a quorum outside of a notice meeting. That's where you would have a violation. There's a couple exceptions, and I tried to put a little extra on the slides because you all have that and can refer to those later. The exceptions here are exceptions to the definition of a meeting. So these exceptions are an attorney-client conference regarding pending or existing litigation, or training regarding the legal obligations of a public body. These do not need to be agendized, open, or recorded. This differs from a closed session, which I'll mention what those when those can be held later. While public bodies are permitted to deliberate during an attorney-client session, if you were to have one, any action still must occur during the public meeting. So to have action, you have to meet and take that vote during a public meeting. You can have a quorum reach that definition without everyone being present at the same time. Electronic communications between a quorum can constitute a meeting. That could mean reply all emails that go between everyone. That could also include serial communications or walking quorums. So that means a couple examples is the best way to explain what a walking quorum is. If you were to have a 7-member body and 3 members discuss an issue after a meeting, so they're no longer in that public meeting, then one member of those 3 goes and speaks with another member a week later and conveys the opinions of the prior 3 members, essentially deliberates. You now have had 4 members collectively deliberate on an issue, and that would be a constructive or walking quorum and could be an issue. So again, this is just to let members know, be aware of these. If you're starting to talk in depth about issues with more than one person, or you have multiple conversations over a period of time, be careful that you don't reach that walking quorum. And when in doubt, always just save the conversation for during a meeting. There are a lot of requirements regarding the format, content, and posting of agendas. Luckily, you have wonderful staff putting together your agendas for the meetings. But the most important requirement that I want to point out for members to be aware of is that the agenda must be posted no later than 9 a.m. on the 3rd working day prior to the meeting. Frequently, that means agendas must be finalized by close of business the day before that, or even a couple days before. Keep that deadline in mind when you're requesting items be included on an agenda, so that staff has enough lead time to get those items finalized and get the agenda finalized in time for posting. There's some additional requirements regarding the law. There are further notice requirements if you're going to consider a person's character, misconduct, or competence, or take administrative action regarding them. I don't think this body will be doing a lot of that, but if you do keep those additional notice deadlines, they can be long. If it's by mail, it can be up to a month. Keep in mind that there does need to be additional notice. Emergency meetings may only be called where there is a true emergency and the need to act upon the matter is truly unforeseen. So we actually had that happen a lot over the past 18 months or so, but prior to this pandemic, having emergency meetings was very rare. And I think going forward at this point, a lot less items are in that urgent state. But if you're ever unsure if you can call it, reach out to me and I can advise on that. Want to make a point about supporting material because we get a lot of complaints and questions regarding it. Supporting material for a meeting means materials that have been provided to a quorum of the public body and that members would reasonably rely on to deliberate or take action on a matter contained in a public agenda. So there's no requirement that a public body have supporting material, but if there is supporting material for agenda items, that material needs to be available to the public. But that document does not become supporting material until it's been both provided to the members and the matter it relates to has been included on an agenda. But just because an item may not yet be supporting material doesn't mean it's not a public record, and it could be requested through the public records process. So keep that in mind as well. As I mentioned, there was a difference between a non-meeting such as an attorney-client session and a closed session. Meetings must always be recorded, and that includes closed sessions. So if you were to ever hold a closed session, that recording may not be available to the public. It has certain confidentiality protections, but it is still recorded because it's still part of the meeting. Public comment is another area. Oh, can we, next slide, please? I apologize. Public comment's another area that's important because we get a lot of complaints regarding it. There are two format options for public comment periods, but the most common by far, the one on your agenda today, is having two public comment periods. One at the beginning of the meeting that can be limited to items on the agenda, and a general public comment period at the end of the meeting. So long as the public body meets these minimum public comment requirements, there's no rule against taking additional public comment, even if the additional public comment periods aren't agendized. So my recommendation to bodies I represent is usually to use the 2-period option that's most common, as it's easy to comply with and it meets the minimum requirements. Then if the chair desires, additional public comment may be called during the meeting if it helps facilitate the meeting. But that way, you know, you've met that minimum requirement and don't need to worry. Public comment periods also have free speech protections, meaning any restrictions to public comment must be viewpoint neutral. This is the public's opportunity to be heard, share praise, and air grievances. And for the most part, that should be allowed. However, the OML does not prevent the removal of any person who willfully disrupts a meeting to the extent that its orderly conduct is made impractical. That again is something that's fairly rare, but that does allow the public body a little flexibility to the extent that you have a very disruptive person that you need, and you need to take action to be able to conduct your meeting. So closed sessions, as I mentioned, are part of the meeting. They may be held to consider the character, alleged misconduct, professional competence, or physical or mental health of a person. They may also be held to grade examinations, but most likely that character reason is the one that you would use if you were to hold one. There's a couple exceptions to that, and any actions still must occur during open session. And again, if you're ever unsure whether you can go into closed session, feel free to reach out to me or there will, I believe, always be a Deputy Attorney General at your meetings who can answer those questions. So as many of you may be aware, especially if you currently sit on or have sat on other public bodies in the past, in March of 2020, Governor Sisolak issued Emergency Directive 6, which suspended the physical location and posting requirements of the OML and allowed for entirely virtual meetings for the protection of public health. Directive 6 expired in June 2021 and was replaced by AB 253, which gives a permanent avenue for virtual meetings. However, if any of you were operating under Directive 6 and got familiar with it, there are some additional requirements with AB 253 if you're going to hold an entirely virtual meeting. The main difference is that a call-in number must be available to the public in addition to any video conferencing means that are available to the public. And the public must have the ability to make live public comment. Email only is no longer an option. And for virtual meetings, I want to emphasize that the public must be able to hear and observe to the same level as members of the body, whether or not there's a physical location available to the public. So this is to the extent that you have any virtual portion of your meeting. That means if members can see each other on camera, the public needs to be able to see what the members see. The same is true for any other type of communication, including chat functions. I frequently advise against the use of the chat functions because it can be difficult to record and difficult to give the public equal access to it. And I know I just blasted through a whole lot of information right there, but does anyone have any questions?
Thank you, Rosalie. Quite comprehensive. Any questions from anyone on the OML requirements? None here in Vegas. Any in Carson or on the phone? Very well. Thanks so much, Rosalie. We appreciate that. and we will move on. And incidentally, folks, if you are not speaking, please go ahead and mute your mics. We heard a little bit of feedback during Rosalie's presentation there. So thank you, Ms. Wardlove. We appreciate you. All right, moving on to the next agenda item, number 8, review and adoption of the bylaws. This is for possible action. You will find in your materials a copy of the draft bylaw, a draft copy of the bylaws. Hopefully you've had a chance to review those. And I will entertain a motion to approve these bylaws.
I'll go through a few things.
You want to go through it
Yeah,
first?
yeah.
Very good. Okay.
Just for everyone, these were provided to all the committee members and as a supporting document when it was posted for notice and the agenda. So I'm just going to hit a couple of highlights, not everything. Some things you're going to hear, you would have heard as under agenda item number 5, but you will hear some of them. I just wanted to say that the purpose is in part to study, evaluate, and make recommendations to DHHS concerning the use of the state and local money to address opioid substance misuse and opioid use disorder from that Resilient Fund of Nevada. And it will be utilizing in part the state needs assessment and the state plan through an integrated approach. The responsibilities, you will hear more about that from Assemblywoman Tolles or Dr. Woodard later, but it's the 17 agenda items directly from the bill. Support can be requested from subject matter experts, and there's a reporting requirement, as General Ford already made note of, on or before the January 31st of each year, and you'll hear more about who needs to get those reports. The membership in terms, there are 18 members who you met this morning. The appointment is for 2 years. It'll be from September of 2021 to September of 2023. And a member can be reappointed in the same matter as the original appointment for an additional 2 years. There's no compensation. If a vacancy becomes available, then that will be filled in the same manner as the original for the remainder of that term. If someone needs to resign from the committee, they must provide written notification to the chair of the working group and the head of their agency or organization that they represent. A person could be removed from the committee if they miss 3 or more meetings in a calendar year, and the chair would forward that recommendation of removal to the AG due to inactivity. The meetings will be conducted according to Robert's Rules of Order and in accordance with open meeting law, which you just heard about. A quorum for this group is 10 working group members. Regular meetings will meet not less than twice a year or called by the chair, and we'll talk more about that a little later. The officers of the working group are the chair and the vice chair. If someone cannot make a meeting, they should advise admin staff of that absence 48 hours in advance, and members must participate in at least 75% of meetings. There will be the availability for subcommittees if those should be needed. A special meeting can be called by the chair or can be requested in writing to the chair by members. Voting, each member gets 1 vote. It's done by voice. A proxy can be put in place for a member if they can't make it, and that proxy would vote on behalf of that member, and vote passes if majority vote affirmative. Fiscal support, you heard that grants and gifts can be accepted. And then if there's a conflict of interest, that would be disclosed by the member. But this committee is not making the actual decisions on where the funding will go. That's going to be done by the grants unit out of DHHS. And then these bylaws should be reviewed at least every 4 years. Thank you.
Oh, okay. Thank you so much for the overview of those bylaws. I think one of the most important notes in there for us to remember is that we do not make decisions on how the money is spent. We make recommendations. That's important to remember, folks, okay? Okay, so with that, I will entertain a motion to approve the bylaws.
Attorney General Ford, Chair Ford.
Yes.
Lisa Lee, for the record, if we could review something, and I'm looking at Article 3, Section 1, C, E, on page 2. It looks like for special populations, we use a lot of person-first language, which I applaud or whoever created these, except for number E, which says intravenous drug users. If we could change the language on that to not reify stigma and use person-first language like people who inject drugs, because also every person who uses by injecting doesn't do it through the vein. So if we could have people first language for that piece, I would totally support this, but thank you.
Thank you. I was reading the wrong E. I was trying to find it, but I got it there. Okay. Thank you so much. And so the suggestion is that we change that to people who use drugs?
Or people who inject drugs if we're trying to elevate people who inject. If that was the intent of that special population. But I just really think that we should use people first language whenever we refer to people who use drugs. Thank you.
Thank you. Okay. Any other comments on the proposed bylaws? Okay, so I will accept a motion to adopt the bylaws as amended.
Stephanie Woodard, for the record, I motion to approve the bylaws as amended.
Dr. Woodard has moved that we accept the bylaws as amended. Do I have a second? Have a second, say your name, please.
Dr. Leslie Dixon.
Dr. Leslie Dixon seconds the motion. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Any opposed? Any abstentions? Motion carries unanimously. Thanks so much, and thank you for the revision there. We appreciate that. Okay. Next agenda item, where am I? Number 9. Review, discussion, and possible adoption of the SURG meeting schedule and priorities for the upcoming year.
Is Assemblywoman Toles here?
She's not.
Okay, okay.
She's not, so I can go ahead and take that presentation.
We're going to put 5 in before.
We're going to go back to 5?
Yeah.
Okay, we're going to go back to agenda item number 5 and have a history and overview of the legislation, including role and mission, and Dr. Woodard is going to lead us through that. Go ahead, Dr. Woodard.
Great. Stephanie Woodard, for the record, thank you for the opportunity to present before this body today. Unfortunately, Assemblywoman Toles was planning to do this presentation herself as the really lead champion and legislator that moved this legislation forward. She was hoping to be here today to really talk about the background and the purpose of this legislation, but unfortunately she's tied up in special session right now. So she's asked me to provide this presentation on her behalf. Next slide. So a little bit of background, and none of this would be lost on this group. Many of you have been asked to join this group specifically because you have some level of subject matter expertise and or experience with the substance use issues that affect Nevada. Through the pandemic, we have seen a 50% increase in the number of overdoses statewide. And we have seen a real shift in change in the landscape as it relates to substance use and its impact on Nevada over the last few years. So this contributes to our escalating overdose death rates, as well as an impact on our healthcare system, our families, and other systems like our criminal justice and child welfare systems. And that is important to know because this group is charged with really evaluating and making recommendations on a broad number of topics as it relates to the prevention, early intervention, treatment, and recovery for substance use. Next slide. So in previous iterations, there has been a Attorney General's working group as it relates to substance use prevention and treatment. But in the past, it was primarily focused on the impacts on communities as well as law enforcement. That Attorney General's working group had sunset just after the previous administration had left. And so we needed additional legislation in order to be able to move this working group forward again. In its absence, we have not had an opportunity to convene a formal body to really evaluate, study, and make recommendations as it relates to substance use and substance misuse, as well as prevention. And hearing that we had a lack of opportunity to really do that formal engagement and convening, Assemblywoman Tolles felt that it was incredibly important to sponsor this legislation. So during the development of the legislation, she engaged a broad number of stakeholders, including prevention coalitions and treatment providers, individuals, families, and communities impacted by substance use, Shatterproof, a national organization for the advocacy of substance use disorder treatment and prevention, the AG's office, DHHS, and NACO. Next slide. So after hearing about the needs, there was a discussion around who needed to be represented. We know that we have a number of different formal groups, especially on the mental health side within Nevada, that do similar activities looking at the needs, gaps, and recommendations for improvements in the mental health system. And this group is primarily focused on substance use and substance misuse. And in recognizing the mission, there was a deliberation on who needed to be involved. So there are representatives from the Attorney General's office, as well as the Department of Health and Human Services, but also through the Nevada legislature. So there are working group members that are appointed through legislative membership, as well as representatives from healthcare treatment providers, law enforcement, individuals in recovery, harm reduction program representatives, and the like. The goal was to bring subject matter expertise to the table, to have real informed discussions so that we can culminate in making recommendations to a number of bodies around the utilization of existing funds, the potential need for additional funds, as well as how those dollars are really used to address substance use in the state, and also bring forward policy issues. So really, we are going to be leaning on the membership of this committee and their expertise in order to really do the deep and meaningful work that needs to be done. Next slide. So the duties, many of you have had an opportunity to read through the bylaws. We're going to go over this not only in this presentation and the presentation after, because we will be using these duties to set our agenda and our course for the next year. But very high level, we will be doing a lot of evaluation of data, as well as existing funds and what is currently occurring within Nevada, working to coordinate. And as you had heard in the bylaws, this group was designed to look at substance use, misuse, and prevention very broadly, but also has a role in providing formal recommendations to the utilization of the opioid settlement litigation funds as set forth by SB 390. Looking at the expansion and availability of treatment and recovery supports, and then ultimately making those recommendations to a number of formal bodies. Next slide. So as it relates to prevention and treatment programs, assessing evidence-based strategies, evaluating existing pathways to treatment and recovery, and examining programs for opioid use and co-occurring disorders. Also touching on the criminal justice system and evaluating criminal justice system substance use-related programs, studying the effects of substance use disorder on the criminal justice system and correctional facilities, and studying the effectiveness of criminal and civil penalties, as well as examining risk factors and data for special populations, the economic effects of substance use disorder in Nevada, and the sources and manufacturing and methods for preventing trafficking of substances within our state. Next slide. When it comes to coordination, looking at how we can expand statewide and local efforts, improve on the coordination and reduce duplicative data between agencies. And we'll be talking a lot about how we do information and data sharing so that we can make sure that everyone is very well informed and really working off of the same information and data as we look to address these issues. Developing the response and overdose prevention strategies for law enforcement and health agencies, and also coordinating the evaluation of that information, again, between agencies. Next slide. Looking to expand and improve evidence-based recovery programs for treatment and support, as well as the expansion of education and harm reduction programs. Next slide. And then, of course, culminating in recommendations. So the recommendations related to prescriptions to the boards, the health division, DHHS, the governor, and the legislature. But also recommendations around the use of the opioid settlement litigation funds. And important to note, these funds through SB 390, which I'll get into in our next discussion, really are meant to supplement and not supplant any existing state or local spending. We want to make sure that they are targeted towards evidence-based interventions, that they support programs for the prevention of substance use disorder in youth, improve racial equity, and also ensure transparency so that there is reporting through public bodies so the public is also aware of decisions that are made and how those funds have been used. Next slide. And so as it relates to annual reporting, there's a bit of a bidirectional relationship here between both the SB 390 and the opioid settlement litigation funds, as well as the advisory committee for a resilient Nevada. And that is the advisory committee that is advising DHHS on the needs assessment and state plan for those opioid settlement litigation funds. And so this group has an opportunity to provide recommendations to DHHS for those funds. And then that group DHHS will also be reporting to this group on how those funds are used. In addition to that, there are additional reporting requirements for the working group. And so the recommendations are required in a written report that is due on January 31st. And so this meeting, this initial meeting, and one of the reasons that we are really focusing on making it a working meeting in the next agenda item is to make sure that we have a course set for this coming year. And what we set forward as work for this coming year will go into our initial report. In subsequent years, we anticipate that those reports will be far more robust, with each meeting of this working group really resulting in recommendations that this working group would be putting forward in those final annual reports. Next slide. So are there any questions so far?
Any questions, Carson, or on the phone? Okay, hearing none.
Okay, next slide. I put this together really just as an opportunity to show how both the SURG, this working group, as well as the advisory committee on a resilient Nevada are similar and yet different. We consistently are getting a lot of questions around what is the difference between these two groups and how they function. They both have appointees from the Attorney General's office. However, there is legislative leadership for the SURG that also provides appointees. The SURG is not specifically tied to any specific funding stream. It's important to make that note. However, the SURG will be charged with making recommendations on the utilization of funds that the state receives to address prevention, substance misuse, treatment, and recovery supports. Whereas the Advisory Committee for a Resilient Nevada is really specifically focused on the Fund for a Resilient Nevada. The SURG will be conducting a review of data, programming, existing funding to establish needs, and really the Advisory Committee for Resilient Nevada is going to be doing very much the same. And the primary goals are similar in that they are going to result in recommendations. However, as mentioned, the advisory committee is really solely focused on recommendations of the allocation of funding through the state plan to address the impacts, risks, and harms of the opioid crisis, where the SURG is much more broad and it looks at the recommendations for the establishment, maintenance, expansion, or improvement of programs to address substance misuse and substance use disorders much more broadly. Both require reporting to a number of different bodies, including the governor, the attorney general, and the legislature. But in addition, the SURG will report and DHHS will also report to the SURG on the funds for Resilient Nevada and how the allocation of those funds has been utilized, as well as any performance measures or evaluation as it relates to rolling those dollars out. Any questions on that before I move on?
Just one quick question.
Yes.
Sorry. Do we know who's appointed, who is part of the ACRN?
Yes.
Is there a list?
Yes.
For the record, so that we can get our minutes right, state your name, please.
I'm so sorry. Debbie Nadler.
All right, Debbie Nadler. And your question again was?
Do we have a list of who is on the ACRN committee?
Yeah, so Stephanie Woodard, for the record, we do have a list. That group has already convened once, and they are reconvening again this week.
So how do we find the list of who's on it?
There's a website that we can provide, which has all of the information as it relates to the ACRN.
Thank you.
Okay, next slide. So just a little bit about SB 390 is it was sponsored by the Committee on Health and Human Services, championed by Senators Ratty and Keffer, but a lot of bipartisan support for this legislation. SB 390 is the bill that established the Opioid Settlement Litigation Fund, which is also known as the Fund for Resilient Nevada, as well as set forth all of the provisions to establish the Advisory Committee on Resilient Nevada. Again, it has a reciprocal relationship with the Substance Use Working Group, and also includes some key legislation as it relates to 988 and some other behavioral health crisis. So there's a lot that's happening in this bill, but primarily as it impacts this group is the Fund for Resilient Nevada. Next slide. And again, the Assembly Bill 374, which was sponsored by Assemblywoman Tolles, a lot of bipartisan support as well, that establishes that Substance Use Working Group, sets forth the scope of work, includes addressing all substances, and results in the recommendations and the development of a much more broad state plan. Next slide. So I think we're skipping now back to the original cadence as set forth on our agenda.
Okay.
So I believe the next item is agenda number 9.
Okay. All right. Well, before you go to agenda item number 9, let us wrap up agenda item. What did we just finish? 5. Any questions, comments, concerns, complaints on agenda item number 5 before we move on to number 9? Okay. Hearing none. Number 9 is a discussion and possible adoption of the SURG meeting schedule and priorities for the upcoming year to accomplish the business of the working group. Leading us to this discussion is again Dr. Woodard. Dr. Woodard, mic's yours.
Thank you. So this is really a working group. The expectation is that we will have some discussion and deliberation, and really looking forward to getting this group's input on how we will set forth the agenda for our work in this coming year. So next slide. So the goals of the discussion determine the foundation for the SURG for our annual report. Our first report is due at the end of January. Establish a framework for the SURG meetings throughout 2022. At the very least, hoping to get some very broad guidance from this group on how we would like to set forth those agenda items for those upcoming meetings. And then determine our meeting schedule for January and potentially meetings thereafter. Next slide. Okay, so I'm going to spend some time actually getting pretty granular around the duties of the substance use response working group because I think having a real foundation in what it is that we have been charged with doing will help us take all of this into consideration as we look towards this coming year and what we would like to accomplish. So again, in review of the duties, it's to leverage and expand current efforts across departments and agencies to prevent and reduce substance use. And this is very broad, so it's not just opioids. We're talking all substances. And identify ways to enhance current efforts to coordinate and collaborate across agencies. In addition to that, it's to access evidence-based prevention and intervention efforts to significantly reduce the burden of substance use. And again, this is across all substances. And that our job is to make recommendations that include primary, secondary, and tertiary prevention, access to harm reduction interventions, and overdose prevention strategies. Next slide. We're also asked to assess and evaluate existing pathways to treatment and recovery for those individuals who are struggling with addiction. And this has to include special populations such as individuals who are incarcerated, pregnant women, individuals who inject drugs, and populations that have been disproportionately impacted by substance use. So not only are we doing the broad strokes on a number of different issues, but we're also asked to determine how special populations may also be impacted. We will also work to understand how Nevadans are able to currently access treatment and recovery supports from various points within the sequential intercept model. And for those of you who aren't familiar with the sequential intercept model, it's a model that's been identified to address individuals who may have risk in impact in the criminal justice system. So all the way from prevention, so preventing, diverting, or deflecting individuals from the criminal justice system, all the way through to re-entering after being incarcerated within the criminal justice system. So this includes a full review of, sorry, let's go back one if you could, because it includes a full review of Nevada's existing law enforcement diversion, deflection, and re-entry programs. Very important because we know that there are a lot of touch points for those kinds of programs and individuals who are struggling with substance use. Next slide. Also to improve and expand evidence-based or evidence-informed programs, procedures, and strategies to treat and support recovery from opioid use disorder and other co-occurring disorders, again, with touch points to special populations. This is incredibly important, as is the next, because we are really trying to put a lens on recovery specifically. For a very long time, recovery has sort of been bunched together with treatment, and we are trying to make efforts to recognize recovery as separate and distinct from our formal treatment system. So the other item is support systems and programs for individuals who are in recovery from opioid use disorder, as well as any other co-occurring substance use disorder. Next slide. To recommend processes and regulations to ensure that opioids are prescribed appropriately. We've had a couple of pieces of legislation that have passed in subsequent legislative sessions that do provide guidance around the prescribing of controlled substances, including opioids, as well as to examine the qualitative and quantitative data to understand risk factors that contribute to substance use and the rates of substance use and addiction in Nevada citizens. And this includes a number of different populations and focuses including health equity and identifying disparities within racial and ethnic populations, looking at disparities in geographic regions, and then again, another concentration on specific populations, including veterans, pregnant women, and parents with dependent children, individuals in the LGBTQA population, youth, individuals who inject drugs, individuals and families who are involved in the criminal justice or juvenile justice or child welfare systems, nonviolent drug offenders whose crimes are primarily driven by their substance use, and others that are disproportionately impacted. Next slide. And our work continues. And this includes developing strategies and implementation plans between local, state, and federal law enforcement entities and public health to prevent and respond to overdose. There's been a lot of good work that has been done in this space to date. Really looking forward to bringing some of that information to this group for their consideration. To study the efficacy and to expand the implementation of programs available to educate youth and families about the effects of substance use, as well as programs aimed at reducing harms associated with drug use and making sure that individuals are referred to evidence-based treatment. Improve coordination between local, state, and federal law enforcement agencies and public health entities to enhance communication of timely and relevant information and data, and to reduce that duplicative data reporting and research activities. Also to evaluate the current system for sharing information between departments and agencies regarding trafficking and distribution of licit and illicit substances. Study the effect of substance abuse on the criminal justice system, including law enforcement and correctional facilities. Study the sources and manufacturers of substances which are abused, as well as methods and resources to prevent the manufacturing, trafficking, and sale of substances within Nevada. Study the effectiveness of criminal and civil penalties in preventing substance abuse and the manufacturing, trafficking, and sale of those substances, and to evaluate the impact of substance use disorder on Nevada's economy. Next slide. So the tasks before us that are set forth in this legislation are not small, but they are often considered sort of interrelated. We can start to see some themes emerge as we look to the kinds of tasks that are set forth in that legislation. In order for us to achieve the goals that we set out today for the coming year, we have been able to provide some support to the substance use working group. So through some grant funding that we have through DHHS, we have partnered with Social Entrepreneurs, Inc. They were actually at the table with us in developing the agenda for this first presentation, and will be providing some administrative support to this group ongoing. They will also be assisting in coordinating presentations with presenters, ensuring all of our materials are prepared for the meetings, detailing any decisions that are made by this group. So they will also be recording any recommendations or decisions that are made, so that we can make sure that we're really tracking meeting to meeting over the course of the year. And then assisting us in drafting the annual report. So they are here today, and I just want to take a second to thank them, because without them, I don't think that we would have been able to pull this meeting off as quickly as we did, and as expertly, with having all of the meeting materials available to us, as well as all the IT support that they've been providing. So a couple of considerations for the framework, and this is really where I'm going to look to our membership to begin to help take shape the agendas for the next meetings. We could potentially look to organize ourselves by topic and group those topics by subject matter, and ensure that we have relevant presentations under each of those subjects as it relates to data, and make sure that we bring to the table subject matter experts to help facilitate some informed discussions and educate this group really on what is occurring in Nevada. We would like to suggest that data presented in the presentations to this group, as defined by the legislation, include those special populations, because you can tell on several of those topics, the goal is to really understand not only in a general sense what is occurring in Nevada, but the disproportionate impacts that it may have on special populations. Also that we have subject matter experts that are able to adhere to guidelines to address conflicts of interest. It's in our bylaws, but we want to make sure that the quality of the presentations that are brought forward to this group really are at the highest level. And what that means is that our subject matter experts would be speaking from a place of expertise, knowledge, education, and experience, so we can hear from them firsthand. But I think this will also limit the possibility of this group becoming a group where we're just hearing from program after program after program to talk specifically about their program, not necessarily around what I think would be most helpful for this group is bringing that subject matter expertise to the table. And that each presenter would be offered the opportunity to present recommendations to the SURG for the SURG to consider. And those recommendations may include, but not limited to, potential policies or legislation that may be needed based on their experience, as well as practices and programs that could be of benefit. So essentially, we would be calling subject matter experts to the table to present data, as well as information for this group to consider, and asking them to offer recommendations to the SURG for us to deliberate and consider in formulating our recommendations moving forward. So before I go any further, I just want to test this with everyone and see if anybody has any comments to sort of this proposed approach for how we formulate some of our meetings.
Lisa Lee has a question. Sorry.
Okay, go ahead, Lisa.
Good morning, everyone. Dr. Woodard, thank you for that presentation that summarized things very nicely, and I like the direction this is going. I just want to throw this out there that I'm collaborating with a couple of researchers right now. We have a deadline to submit manuscripts by mid-January, and this would be qualitative data we've collected with people who use drugs and people in recovery across the state, including places in rural Nevada. So I would be happy to present our findings and recommendations at some point, probably mid next year. And then the other project, we're just discussing data analysis at this point, but we gathered, myself and Dr. Carla Wagner gathered qualitative interview data from people who use drugs in Washoe County and Clark County. And we do plan on having some policy recommendations from those data as well. So I just wanted to present that here. I don't know if that's a conflict of interest, but I do believe that bringing the voices of people who are currently using drugs or in recovery from an opioid use disorder in this way would be beneficial. Thank you.
In response. No.
So Stephanie Woodard, for the record, thank you for making that offer. I know we also reached out to Dr. Wagner to use some of that qualitative data to help to inform the needs assessment as we set forth for SB 390 and the Fund for Resilient Nevada. So do completely agree with you that having opportunities to bring forward the voices of individuals who use drugs as well as those in recovery is incredibly important to help to make sure that this discussion is as informed as possible.
Absolutely, and it would, Aaron Ford, for the record, it supplements who we have on this committee as well, right? We have representatives from those groups as well here who can speak to those issues, and so I appreciate that, Lisa, as an offer. Obviously, this isn't a committee that wasn't created to do nothing. There's a lot that we have to do. To your question earlier, you asked if we had to wait until 2023 to do something. Absolutely not. Have a lot of work to do here. It's a daunting task, it seems to me, and these are meaty subjects that we have to take. And so I'm glad that we have the assistance of Social Entrepreneurs Inc. Thank you so much for helping us to coordinate some of this. And I like the way you present this as ways that we can meet. Now, we're only required to meet twice a year. Clearly, that's not going to work. Just to let you all know, that's not going to work. We have a report due January 31st of next year, and we will have as much of a robust report as we can get prepared for that. But certainly by the legislative session in 2023, we expect to have real recommendations from a legislative perspective and otherwise. And so anticipate more than 2. I don't know how many we'll have, but certainly anticipate more than 2 meetings next year as a committee on this.
So Stephanie Woodard for the record. If we could go to the next slide. So a couple of considerations for a framework on how this group might be wanting to formulate the meetings going forward, really just by subject matter. I think it may be helpful for this group if we, instead of just sort of went down all of the lists of duties that the SURG has, kind of in a haphazard way, that we try to organize ourselves so that we're really focusing each meeting or a portion of the meetings on specific topics. So some considerations for that framework could include grouping topics such as substance use prevention, reducing harms, early intervention and treatment, recovery supports, the information related to criminal justice, and data and information sharing. But before we get to this, I do want to make a point to Attorney General's point earlier that we do have a report that is due at the end of January. And so we were hoping to potentially convene again in January as the Attorney General is available to review that report. But I think it's also important to recognize that we have sort of 2 parallel paths that are occurring simultaneously, and that is the work of the Advisory Committee for Resilient Nevada. Now, this group, the SURG, is charged with making recommendations to DHHS as it relates to the opioid settlement litigation funds. And I don't want to miss out on the opportunity for this group to be able to do that, depending on the cadence of meetings. So the needs assessment is currently just getting underway. The needs assessment is required by the legislation, SB 390, specifically for the Fund for Resilient Nevada. Nevada DHHS has contracted with Mercer as well as UNLV to do the qualitative and quantitative data analysis. And we've already started to convene some subject matter experts to be able to pull documents that could be used in the development of that needs assessment. That needs assessment is expected to be completed sometime in February. If we meet again in January to review the draft of our report that is due at the end of January, and use that meeting as an opportunity to review at least the initial findings of the needs assessment and provide some feedback, then we can ensure that this group has an opportunity to really get their foot in the door as it relates to recommendations for the Fund for Resilient Nevada. The needs assessment for the Fund for Resilient Nevada will culminate in a prioritization process as well as a state plan. That state plan will be used for the allocation of funding. So it will allocate at a very high level how funds should be used as they come into the Department of Health and Human Services into that Fund for Resilient Nevada. And this is where things get a little more challenging, because that needs assessment is expected to be done at the beginning of February, with the state plan being finished sometime towards the end of March, beginning of April. So depending on when this group decides to meet next, we may or may not have an opportunity to really provide feedback on that state plan and make sure that any recommendations that this group would like to have considered in that state plan have an opportunity to do so. So it If we wanted this group to have an opportunity to provide some recommendations for the state plan, we may need to look at potentially convening again at the discretion of the chair sometime in March.
Yeah, Aaron Ford. So this is all part of the same discussion group. So January 19th, 9 a.m. Is likely to be our next meeting date. So Wednesday, January 19th, 9 a.m. So please mark your calendars for that. And it seems to me that March, would be appropriate. Oh, okay, we have it there. So on the screen, it says January, April, July, and October.
That was if we met at the quarterly cadence.
Uh-huh.
And I just learned this morning that we may actually need to meet in March in order for us to help to support meeting the deadlines for the advisory committee.
Okay. I mean, then so be it. I think we should meet in March, and we'll send a doodle around or something and figure out when in March to meet. But January 19th, 9 a.m., please lock that in. And we will circle back on March.
Okay. Thank you for that.
Mm-hmm.
Stephanie Woodard for the record. So looking to set the agenda for our January meeting then. We would be reviewing and finalizing the report that is due January 31st. And then we would potentially, if the committee chooses and at the chair's discretion, have both Mercer and UNLV, who have been contracted to conduct the needs assessment, to be able to come to this committee and report on some of their initial findings. So wanted to make that as a suggestion for a potential agenda item.
Works for me. And any comments on that? We're going to add that to the agenda per chair's discretion. But any other comments or questions about that? Yes, ma'am.
This is Dr. Dixon. This is about the needs assessment. What exactly is the needs assessment consisting of? Like, who's being assessed and what needs are being assessed?
Stephanie Woodard for the record. It's an excellent question. So the needs assessment is specifically for the Fund for Resilient Nevada. And so it is to look at the risks, harms, and impacts that the opioid crisis has had on Nevada. We know that this is not anything new to everyone in this room and meeting with us virtually. There's been a lot of work that has been done over the last 6 or 7 years, specifically to address the opioid epidemic. And so we're not looking to recreate the wheel. As you had heard through the Attorney General's office presentation by Mark Kruger and CJ Bradley, the amount of documents that DHHS was able to produce in support of this litigation is voluminous. Mm-hmm. And so we're not looking to do any additional real data analysis. We have the data. We know a lot of this information. And so the goal of the needs assessment really is to elevate what is known so that we can take all of that into consideration as we look to the priorities and the development of the state plan. What we have decided to do as an approach to that needs assessment is to look from current day backwards versus then going historical forwards, primarily because the opioid crisis really has shifted and changed considerably over the last couple of years. And so we want to make sure that we are capturing as close to the here and now as possible so that we can make real-time recommendations for the utilization of that fund. That fund has 3 primary priorities that are already set forth in legislation, and the first of which is to save lives. And so we want to make sure that we get these dollars out as quickly as possible to get into the communities to assist in reducing the harms and the overdose epidemic as we're seeing it, which will require us to revisit some strategies that we've used to date. In addition, it does prioritize prevention for youth substance use, as well as ensuring that we are addressing racial equity. And so we are doing as much as possible to bring forward those documents that already exist on what we have done and what we know needs to be done, as well as some of the data that's been collected for the litigation to include in that needs assessment.
Thank you. Good. All right, thanks so much. You can keep going.
Okay, all right. So Stephanie Woodard again for the record. So it sounds like we have a good start with the agenda and the topics that we want to address in January. And then if we are meeting again in March, the goal of that March meeting, at least in part, would be to review as a group the draft state plan and have open discussion and deliberation of additional recommendations that this group would like to see included in that state plan.
That's great.
We could conduct additional discussion, should the chair choose, to talk about the way that we may want to formulate additional topics to be addressed at future meetings next year. Maybe not settling on dates, but potentially cadence and topics.
Yeah, I think that's appropriate. I mean, I like the way you, the six bullet points? 6 bullet points you have here. I don't know if it's too much time to group them 2 at a time per meeting. Sometime after March, right, where we start on a cadence of meeting and trying to get information and recommendations in on that in time for our January 31st, 2023 report that's due, which will also inform potentially legislation. The way it works, well, as you know, the BDRs will be, for legislation will be due well before our January 23rd, January 2023 deadline. But these conversations can help inform that, especially when we have assembly persons and senators who are on this committee. Maybe they can adopt some of these things early on and put them in as a bill draft, even as a holder. So that's what I envision. I envision maybe grouping these in twos. So that's at least 3 meetings there beyond the March meeting, maybe including the March meeting. I don't know. We'll have to see what else is on the March meeting agenda, but certainly 3 more meetings at least after January. Yeah.
Yes.
Okay.
So I think the question, Stephanie Woodard for the record, would be the length of time for those meetings.
Yeah.
If we anticipate 2.5 hours or a half day.
Well, that's a great question, because one of the things I was going to suggest was that we do set time limits on our meetings so that we respect each other's times to be able to get in and get out as we need to. So today's meeting is already an hour and a half, and 2 hours. I don't know. You have to tell me, is 2 hours enough to cover 2 topics per meeting? No. 3 hours?
Danny Tillman for the record. I would say 3 hours at a minimum. Some of these topics, especially if we take them in the twos, there's so much overlap. I can talk with you for 3 hours about the criminal justice side and the reentry side. So I think that, you know, even if we set a half-day limit and if we convene or if we can end early, great, but at least giving us a framework to have 2 hours per topic even. I would be comfortable giving that amount of time to this committee.
All right. Yes, ma'am.
Jessica Johnson for the record. I agree with Danny's statement. I was also thinking and wanted to bring up the role of subcommittees and in order to address such and the expertise in this room and in our state. Just wanted to see what the thoughts were on how that might serve to move to help meetings be timely.
Yeah, it will certainly help us move this time. That was another topic I was going to mention with subcommittees. No, it's fine. That's perfectly fine. Subcommittees is where most of my committees get their work done. If you want it done, it's going to have to get done in subcommittees, just to be clear. So, you know, we're going to designate folks in subcommittees, but probably not today. That designation could potentially take place as early as January. So stay tuned for that. So I'm hearing at a minimum 2 hours per topic is what I've heard, at least as I'm seeing heads nod here. Do I have any responses to that suggestion from Carson or on the phone?
Just a quick clarification of who was speaking before.
Jessica Johnson.
Thank you. We can't always see her here. Thank you.
Sorry. Yeah. Okay. So it sounds like we're looking at 4-hour meetings. commencing potentially in January, but certainly March and beyond. So that's what we can count on, starting at around 9. We'll take a quick lunch break during that time period to let people eat, and then culminate after the 4-hour time period. Does that sound acceptable to everybody? Any objections, I should say? Okay, all right. So that's what we intend to do. 2 hours per topic, and we'll group them into twos, as I've indicated. And then we will work on the subcommittee stuff, because you'll be also coordinating with, my colleague here, as they bring in the experts, and the subcommittee can work with the experts as well to help the agenda items and presentations and things of that sort, if that makes sense. Yeah, okay. I'm just making this up as I go along, y'all. So if I'm not doing it right, y'all can tell me. Yes, ma'am.
Yeah, Jessica Johnson for the record. I just want to make a comment on the framework, if that would be all right.
Absolutely.
I know that in the presentation, data was really mentioned. Something that I think would be important for this group, having worked sort of regionally on this, is to maybe convene experts that can speak to the regional impacts of whatever subject matter expertise they're bringing in, whether that's reducing harms or prevention, et cetera. So just in addition to, I think the numbers are helpful for decision making, but I think someone who could speak to maybe the Northern Nevada impacts, the Southern Nevada impacts, the rural community impacts, or regional rural impacts. I also think it would be helpful to know about sort of current efforts that have either been successful or had some footing in these regions or areas in the community, so that we can know what's been successful in addition to those recommendations. I think that would really help ground this committee in either recommending what we would want to continue in these areas, and also what might be new or innovative that could be brought to the table as a recommendation. So I do think that the data are valuable for decision making, but I think without context of some of those experts who have maybe either implemented or know about the programs in those communities, I think we might be missing a little bit of information.
No, I appreciate that. And Dr. Aaron Ford, for the record, Drs. Kern and Woodard, I'm hearing you loud and clear. And I'm certain we'll ensure that as we get these topics presented, that we will inform the presenters that we'd like to hear those items addressed as well. Are there other topics that folks would like to see? You don't have to make your minds up today, but just think on that as we continue. If you want particular things presented in these presentations, let us know, and we can ensure the presenters know that we expect to see that type of information. Okay. Any other questions, comments? Were you done? I'm sorry.
Oh, sorry. This is Jessica Johnson for the record. I had just one other thought. In my work, I'm wondering if criminal justice might be separated into two. Just thinking specifically about the sequential intercept model, thinking about deflection, diversion, and sort of that like pre-justice system efforts, and then thinking specifically to your point about sort of re-entry and programs and strategies within the community that might support that. I'm just wanting to lend the time to that topic that it might need, based in anticipating that there may be several sort of policy recommendations to that piece. So that just a thought for.
Okay.
Thank you.
Okay. All right. We'll think on that. I'm not agnostic. I'm a little agnostic to it, but I'm not adverse to it. So we'll think on that. Yes, ma'am.
Danny Tillman for the record. I was actually going to expand on what Jessica said. There's actually, in my mind, I see criminal justice as a 3-point topic. It's the pre-incarceration, those diversion methods, the incarcerated treatment, the therapeutic programs inside, and then reentry is a very specific topic on its own.
Okay. I'm not adverse to any of that. I just want us to know that's more meetings. That's more time, that's more work. And if we're down with it, I'm down with it. But we just have to be certain that we're going to be committed to it, because the report that we submit and the ideas we come up with have to be fully thought out and vetted. So we will absolutely keep that in mind as we're scheduling these meetings going forward. We also have some of you are on other committees as well. And I know that that's going to overlap on your time commitments as well. So let's just keep that in mind as we think about what we're doing here. I mean, it'd be great to accomplish everything in a 2-year time period before the legislative session. Unlikely that's going to happen. And so it's important that we think about potentially biting off a few morsels at a time and focusing on things that we know we can get done. But again, that's not a decision to be made today, just my thoughts in response to some things I'm hearing right now. Okay, other questions? Yes, ma'am.
Debbie Nadler for the record.
Yes, ma'am.
There's certain things that can be, I mean, we're not going in that specific order, are we? Is that what you're recommending?
Stephanie Woodard for the record, no. I was simply just trying to put a framework together, but the order in which we address any and all of these topics is completely at the discretion of the chair with recommendations from this committee.
So Debbie Nadler for the record again, substance use prevention would be the early childhood education and all the education and prevention in the schools and the billboards and all that. I think personally on that level, that needs a full 4 hours in itself, is the prevention and education, because of where we're at with the epidemic right now and the younger and younger children using. That's my recommendation. And that's broken down as well.
Okay. Thank you for the input. Okay. Yes, ma'am. Lisa, is that right?
Yes. Thank you, Chair Board. Lisa Lee for the record. In thinking about this, and I don't know if it would be under recovery supports, but thinking about the ways in which social determinants of health, and I'm thinking isolation, I'm thinking housing, the way those things have impacted people's choices, whether they have reoccurrence of symptoms or ongoing or a chaotic relationship with substances. I don't think we give enough airspace to really working out the importance of social determinants of health and their role in interrupting intergenerational cycles, and specifically how social isolation and poverty can really impact intergenerational use. Again, those are big, meaty topics, and I'm not sure where they fit in, but I want to make sure that's on record as a big need to sort of unpack those things and their role in my friends continuing to die. Thank you.
Thanks, Lisa. Other comments? Any others from Carson or on the phone? Okay, a lot to chew on here, a lot of decisions to be made, not necessarily today, but to be made soon. So go ahead, Stephanie, anything further you have?
So Stephanie Woodard, for the record, again, just want to reiterate some of the decisions that have been made and to see if there are a grouping of topics that we would like to address at subsequent meetings. Again, really, we're just managing towards that final report, the annual report that will be due in January. So any additional input we want to make sure is considered for that report. So we will have, in addition to the March meeting, January and March meetings, we will have 3 additional meetings, potentially with 2 topics each, with a 4-hour allotment for each of those meetings. The chair has noted consideration of subcommittees, and I think that the conversation here has been very helpful in recognizing sort of the depth and breadth of many of these topics could easily exceed 4 hours. Oftentimes we're going to conferences where we're spending 4 days on any of these topics. And so we're going to have to be very selective and strategic about how we address these issues, recognizing to the chair's point that the likelihood of us accomplishing everything that has been set forth for us in the legislation over the course of 2 years, it's going to be very difficult for us to do. And so making sure that as we develop agenda items going forward that we're keeping that in mind and trying to make the best use of that time to make sure that each of us has an opportunity to contribute to the recommendations ultimately that are coming out of this group. So to that end, are there topics that we would like to at least see grouped together, or is there an order of preference that this group would like to put forward related to the topics in each of the meetings? Certainly all of this will be agendized at the chair's discretion, but just wanted to put it out there now Are there issues of priority that you would like to see either grouped together with one another or to come earlier on in the year's agenda versus later?
Chairman Ford?
Yes, give me a second, Deputy. Yes. Go ahead, sir.
Chairman Ford, okay. This is Eric Schoen with Community Chest up here in Northern Nevada. Can you hear me?
I can, Eric. Good to hear your voice, man. Go ahead.
Great, perfect. So I was trying to chime in earlier when Lisa Lee was speaking about social determinants of health, and I think that's the closest bridge to what I see are necessary adaptations when we're thinking of developing capacity in rural Nevada. I don't think it's necessarily one size fits all, and I know everybody probably understands that, but it's very nuanced work along the lines of what Lisa Lee was talking about, and that is addressing the social determinants of health and how they drive choices and what's available, the resources that are available on the ground in rural Nevada. So thinking about how we can build capacity in rural Nevada that really meets the needs of rural citizens. So I just wanted to add that as something else to consider as we're trying to develop the agenda.
Absolutely. Thanks for that, Eric. Thanks for that input. Were you going to say something? Okay. Yes, ma'am. Ms. Nadler.
Deputy Nadler, for the record. As far as in order, just my thought, if we could start with the awareness and the prevention due to the fact that our overdose rates are enormously high right now with the young kids, I think the first priority would be to work on the prevention aspect in the schools and all over. That's my thought.
Okay. And so in terms of groupings, I don't know, again, this is not my expertise, y'all, so feel free to fight me down. No proper authorship here. Does it make sense then to talk about substance use prevention with early intervention and treatment, or early intervention at a minimum?
Early intervention.
I mean, I don't know if the treatment component goes with it right now, but I mean, that's a grouping that seems to me, at least just looking at it on paper, that makes sense. Substance use prevention and early intervention and treatment. Any objection? Yes.
Yeah, for the record, sorry, but just like you said, early intervention and treatment is almost two different things, but I like the idea of the substance use prevention and early intervention as a combined.
Yeah, it may very well be that recovery supports and treatment kind of go together more than something else. But Jennifer? Jessica.
Okay, Jessica Johnson for the record. Thinking about the Institute of Medicine's continuum of care for substance use, one thought might be to keep substance use prevention. We could talk about sort of universal primary prevention efforts and then some selective secondary prevention efforts. And then reducing harms is kind of considered an indicated or a tertiary prevention effort, sort of before you get to a diagnosis, which would then qualify as treatment. So just thinking about one strategy might be to talk about sort of health promotion, prevention, and kind of group it in that way. And so therefore having substance use prevention and reducing harms sort of in one presentation. And then to your thoughts about the early intervention, treatment, and recovery supports and sort of a secondary grouping.
Okay.
I also thinking through that in the criminal justice piece, I think there are some opportunities for information and data sharing. So there may be some overlap in those. Okay. Thinking through sort of public health, at least from the public health perspective and criminal justice perspective, I think there might be some great recommendations from similar experts through that. Okay. Those are just my thoughts.
More informed thoughts than mine, and thank you for suggesting it. Lisa.
Thank you, Chair Ford. Lisa Lee for the record. One additional thought. So, I'm not sure if it would be within criminal justice. I see it as separate, but the conversation on the child welfare system and substance use, particularly the opioid use, thinking about recently published research that show that there is a correlation between overdose rates increasing and child welfare removals increasing in communities. I think that's important to think about. I also don't see overdose prevention included here, and I think that deserves also kind of its own spot on the agenda. But thinking about the child welfare system, I know that there's efforts across the state to incorporate CARA plans of care, as well as the Family First Prevention Services Act. And some of those programs are particularly related to parental substance use, parents with dependent children, and prenatal substance exposure. And so I really think that we, again, should think about that because, again, I always think of where do we start interrupting intergenerational cycles? So I want to make sure that we're thinking across the lifespan. And I think that's a separate conversation than early intervention and treatment or criminal justice. Thank you.
So I'm feeling overwhelmed. And it's probably because I'm not the expert in this as you are, but that's a lot for us to discuss and decide. And it seems to me that it may be helpful for us to, and Rosalie, if you're still there, I hope this is okay. You can send ideas for topics like this, like you just laid out, Lisa, to Dr. Kearns. She can compile all of that, all of these ideas, and we can revisit this in January. Winnow down maybe topics, or leave them all there, and y'all decide we're meeting every other week, and that's fine. I mean, I'm here to do whatever we want to get done, but there's been a lot that's been discussed today, and I'm just not certain that we can right now decide even what we're going to talk about in January. Besides looking at the report and maybe something else, but so why don't we do that? Rosalie, I think I'm okay with her doing that, right? She can, okay. She's shaking her head, yes. Everyone senior, thank you. Okay.
Can we just add too about looking at the info from the needs assessment in the January meeting, or?
Yes, Stephanie Woodard for the record, making sure that we have the vendors that are contracted to bring forward some of those initial findings from the needs assessment.
So there we go. So we have at least 2 agenda items that we know about, maybe 3, because I think you mentioned 2 different entities for that. All right. So yeah, and in the meantime, in short order, please, don't wait till the last minute, please. Email ideas for topics that you would like to see discussed in this to Dr. Kearns in short order. We'll try to get those grouped. I say she will try to get those grouped, and then we will kind of take it from there and make actual decisions in January. So we're prepared to do that. Yes, ma'am. Dr. Woodard.
Stephanie Woodard for the record. I would like to request that for agenda items for future meetings as they're being sent to Terry, if they could also highlight specifically which task under the legislative tasks that would be assigned to. I think that will help us all make sure that we don't end up with some scope creep, but that we're also equally addressing each of those topic areas as we develop the agendas going forward.
Well, let me repeat that. I think that's a very good point. Do have keep handy your bylaws, because your bylaws do detail what our roles are. And the suggestion or the request was that when you submit something for agenda item, attach it to one of the A through Qs to determine where it fits into our scope, so that we don't have the mission creep as she's indicated. Okay. Okay, Dr. Woodard, anything further on this?
Thank you, Chair. That concludes my presentation.
All right. Well, thank you. No, that was thank you so much. I couldn't have done this without you, that's for sure. Okay. Any final comments, thoughts on agenda item number 9 before we move on? Okay. Let me thank y'all again for this robust discussion. It was very, very good, and I think it's going to be helpful for us going forward. So as a reminder, next meeting is Wednesday, January 19th at 9 a.m. We'll move on to agenda item number 10, which is public comment. Is there anyone in the room for a public comment here in Vegas? Yes, ma'am.
Dr. Leslie Dixon for the record. I just wanted to tell people that we have an upcoming conference in February. The Nevada Psychiatric Association always puts on a conference every February. and psychopharmacology oriented, but the pre-conference is going to be on addiction psychopharmacology. So we have national speakers coming to talk about several of the substances of abuse. It is fairly medically oriented, of course, but I think some people might actually enjoy coming to it and hearing about how the medical community is approaching substance abuse.
All right.
So I have a few brochures here if anyone's interested.
Thank you, Dr. Dixon. I appreciate that. Any additional public comment here in Las Vegas? Yes, ma'am, Ms. Natalie. That's fine.
Debbie Nabla for the record. And I like what you had to say. If we, as members of this SURG committee, if we have any functions going on such as that, can we have the list to email each other? Can you email us your event that you're doing? Are we able to do that?
We can push it out through you can email that to me and we can push it out.
Dr. Kearns, yeah, get information, Dr. Kearns. We want to be certain that we don't violate open meetings, and I have no idea if that does or not, but Rosalie will let us know. In the meantime, you can get information from Dr. Kearns and she can push it out. Okay. All right, anything else in Las Vegas? All right, how about on the screen? Anyone for public comment?
There is a comment here. Someone has their hand raised. Rhonda Fairchild, I'm going to allow you to talk here.
Okay, thank you. Go ahead, Ms. Fairchild.
Rhonda Fairchild for the record. I'm with Center for Behavioral Health and There Is No Hero in Heroin, a nonprofit in Las Vegas. I have a question about the subcommittees. Will the subcommittees meet privately or will these meetings be open to the public?
So generally speaking, I can't respond to public comment questions, but I will say as a general matter, subcommittees are also subject to the open meetings law.
Thank you.
Any further public comment on the phone or in Carson City or elsewhere? Okay, hearing none, I will adjourn us. Thanks so much, everybody. Y'all have a great rest of your morning. Bye-bye.
You did good over here.
Yeah.
Sarah, unless you need anything from me, I'm going to sign off.
Sorry, I was just figuring out how to close up here, but yes, I think that's fine. I'm going to end the webinar for all and that should stop the recording. Thanks, everyone.
Thank you. Bye-bye.